announcement of Q4 health products and technologies dispatched to the counties, we are proud and privileged to celebrate this occasion with Makueni County, the first county to place its Q4 order. We therefore celebrate you, Governor Kivutha, and your team for putting your faith in us as your preferred HPT's supply chain solution provider. As a testimony to the reforms at KEMSA and their continued effectiveness, I would like to confirm that the turnaround time for this order has been less than 5 working days. Yes, the same KEMSA that was previously would turn around other orders in 100 days is now receiving orders, processing and dispatching the same in less than a week. The reform progress at KEMSA has been made possible by the support of our stakeholders. Among other challenges, we previously had poor credit management systems, which negatively impacted our capacity to pay our suppliers. Reforms that kicked off late last year have, however, seen us improve on debt collections, allowing us to improve our relations between our suppliers and clients such as Makueni County. Inventory management systems have also allowed KEMSA to improve its stock holding. We can almost accurately forecast the items that a client such as Makueni is likely to order in the next cycle, thanks to the data analysis tools that we are currently using. By using information technology systems, we now have an almost end-to-end stock visibility and better forecasting capabilities. Ladies and gentlemen, allow me for a moment again to celebrate Makueni County for its continued patronage of KEMSA. Makueni County is one of the counties that remains very credit-worthy as a business partner. This county continues to settle its accounts on time. To enable KEMSA to improve its efficiencies, Makueni was also one of the first counties to link up to the KEMSA's Logistic Management Information System, which is part of the authority's enterprise resource management system that facilitates better operating information visibility across the supply chain system and contributes to inventory accuracy at the national and county levels. At KEMSA, we are banking on technology and our dedicated staff members on our transformation journey. Indeed, all KEMSA business processes are becoming automated fully through our enterprise resource planning, our logistics management system, and the KEMSA e-mobile service that will facilitate on-time stock fulfillment to more than the 11,500 public health facilities countrywide. Coming back to Makueni's county celebration, this is the only county that has consistently procured HPTs every quarter, every financial year since the inception of devolution in 2013 from KEMSA. Makueni County procures its supplies 4 times every year and promptly settles its account. Indeed, at KEMSA, we consider Makueni to be our best county in the country as far as debt management is concerned. Makueni County was also the first county to adopt LMS way back in 2013. They have continuously supported all our pilot projects geared towards improving LMIS functionalities. And I think, Governor Kivutha, this speaks to your openness to innovativeness and technologies, which we've been discussing a few minutes ago. Ladies and gentlemen, this morning we are flagging off the first national Q4 HPT's consignment dispatch. This consignment is loaded in 10 trucks, including, and it comprises of oncology, renal, surgical, and related items, including laboratory, radiology, dental, and linen items. The consignment, valued at more than 37.6 million, is destined for 240 rural health facilities and 13 hospitals spread in 6 Makueni sub-counties. It is impressive to note that since the advent of devolution, the availability of HPTs in all the health facilities in Makueni has remained constant. Attesting to Makueni's positioning, many counties have made visits to the county seeking to learn and emulate the efficient commodity management systems that have positively impacted the citizens' quality of life in the county. Ladies and gentlemen, last but not least, let me reiterate that transformation efforts at KEMSA are firmly on course. We are pursuing a 3-pronged transformation strategy which focuses on driving operational excellence, enhancing customer experience, and repositioning the organization. Thank you for your continued support, and we do not doubt that the transformation journey will be achieved much faster than expected. Thank you.
We had previously come to this institution because we have been transacting business for a long time since the inception of devolution. But this visit is kind of special because we took time to be taken through this facility as well as the new procedures, processes, what you're doing to revamp this critical institution in our country. And I must say personally, I am encouraged after listening to how business is being transacted now with the onset of the new board and the new management which you chair, which you're in charge. I think this institution is so central with NHIF for the delivery of the President's Agenda 4 of health, universal health care. And therefore, even though he's going to exit in August, but I think the reforms that are happening here, the reforms that are happening in NHIF, and other places in the health sector, in the health public sector, are going to make his dream of universal health care a reality. And having, made some conversation with the staff, your senior staff, before you came from the ministry, a meeting from the ministry, as a person who listens keenly to processes and to evaluate what's happening, I'm really encouraged. From the point of COG, we are also happy because we had been struggling in the past to have representation on the board, and that has become a reality. It means that COG and KEMSA will have easier times talking to each other, negotiating, and this is a very positive thing, and COG is happy because of that innovation. One distinguishing feature of KEMSA as of now is it will take, for example, all our drugs and non-farms to each health facility so that we don't have to pick them from one central place and take them to our facilities. And that, first of all, makes sure that the correct drugs and so on reach the facilities, and they do that quickly. So for us, we really like that, and it's all the counties. We really like that. Although we should have more money from the center for health, we have tried our level best to use what is available to make provision for our people for health services. And sometimes we have challenges of drugs because, as you have correctly pointed out, drugs are 40% of all that is expected in the health sector, and sometimes there are shortfalls. But we think going forward, more monies will be released to the health department, and maybe for certain things like drugs, the monies for that will be ring-fenced so that they can't be used for other purposes, and therefore drugs and non-farms will reach the facilities and the people as should. Even as we made discussions with you, it occurred to me that as this facility continues to grow, one can even possibly think of helping other countries, our neighbors, who may not have facilities which are like this, because the way it is developing, it's likely to become one of the premier institutions of the continent in terms of supplying products to in the public sector, including faith-based organizations. So that's a growth point, and maybe even later one can consider uh, uh, selling also to the private sector for a bit of course, profit to gain sustainability, but also to ensure that the quality of the drugs is guaranteed, because this is an institution where there's the most rigorous way of making sure that the quality of drugs is assured. So I think the future is very bright. Maybe in the past there were certain things raised and so on and so forth, but I believe that if you go the path you're going now with the new management, the new board, uh, we will see a new look KEMSA, and that is already beginning to be evident, and it will serve our universal healthcare program. And of course, I'm excited about Baba Care. I cannot hide that. And I think when KEMSA develops, continues to develop well, and NHIF, then Baba Care uh, will be secure, and generally universal health care will be secure in our country. Um, you know, in the African culture, we think it's only women, particularly in the rural setting, who sweep the compound. They use a broom in whatever way it is to sweep a compound. I'm excited that this organization, important, the president and generally the ministry thought it fit that a lady who is capable heads it. And maybe uh, sometimes ladies have a way of ensuring there is more integrity in institutions. And so that is expected of you.
To be grateful for the partnership that Makueni County has had with KEMSA. I think we were the first county in this country to transact business with KEMSA since 2013, when all other counties had run to procure commodities from the private sector. And we have stuck with KEMSA since 2013 because we have believed, for purposes of quality products, we ought to have sourced from this national supplier. And our experience with KEMSA has been good. Previously, the fill rates were a bit low, but I'm glad that today we are able to get 95% of the commodities we ordered. And that attests to the reforms that already are happening in KEMSA. For us, you have heard that we've been very, very creditworthy. We've been settling our debts in good time because we believe if KEMSA is starved of cash, it will not be able to continue to offer the services that are needed to its clients. And in keeping with the Big Four agenda of the President towards UHC, Makueni had already started a program called Makueni Care, where households pay only 1,000 shillings per year, and they are able to get services without paying at the point of service for 1 year. And KEMSA has really been a strong supporter for us to make sure that our local model of UHC in Makueni is able to stay afloat and we give quality services to our people. So today, as we flag off this consignment for Q4, the 10 trucks to our public hospitals in Makueni and also faith-based institutions, we really want to thank God and thank KEMSA for the very, very robust partnership that we've enjoyed for the last 10 years. I'm
excited that they have been able to shorten the turnaround time because previously we could do anything between 2 weeks to a month, but now we are actually surprised that we were able to get our order processed within 1 week. That's really a great milestone. Also, we have been told that 95% of the items that we required have actually been availed to us, and that to us really is a very great thing. We've traveled a long journey with KEMSA. We know where we began, and we are very hopeful that we keep achieving milestone after milestone towards the attainment of UHC, because we believe that without KEMSA, we will not be able to complete this journey of UHC.
Thank you for joining us this morning as we celebrate the commencement of Quarter 4 Health Products and Technologies dispatched to the counties. We are proud